You said another thing earlier, which was really cool and interesting, and that's that all of the indicators might be that things are good, and you're not noticing all these little details coming out of, just missing this patient or I don't want to say forgetting, but you know what I mean? Like things just slipping through the cracks for like this coordination problem or that.
What that really brings up to me is the issue of accountability. And it's one of the things that I've found in working with clients that gets really challenging because in home health, there's two cultures in every company. There's the clinical culture, which is majority of the culture as it should be.
As it should be.
But then there's also the business element. And so generally the clinical culture is the primary culture, but oftentimes administrators or at larger companies, VPs, the operational side, a lot of times there's some conflicting things there. And so for me, the first project I did, when I recommended, hey, we should have a CRM system for a loose term for the intake team, there was massive resistance on that side. And then, so I asked the intake team, I'm like, okay, what do we think our admission percentage is? Let's go calculate it. That's how we got those 75% numbers, but we weren't counting referrals that never made it to a certain stage. If it was forgotten, we didn't, oh no, that the doctor never called us back.
Yeah.
Well, to me, that's on us, not on the doctor, right? We can't say, oh, they didn't send a complete referral, so we don't really like working with it.
So it doesn't count as in the total that we're calculating, yeah.
Yeah. Anyone can calculate a 100% admission rate if you want. Only count the referrals that started care.
Well, that's manufacturing your success. You're essentially just like removing the inconvenient pieces to just get to the prettier picture.
Yeah. Oh, that one? No, Dr. Johnson never sends the right referral for. Well, shouldn't the marketing team know? Shouldn't we go educate, have an in-service? Sounds like a marketing opportunity to me. Maybe we can help provide better service. Maybe they can tell us that our fax number doesn't work or that 1,000 other things are there. So.
Right. Well,
yeah.
And there's a big emphasis on performance improvement, but you kind of think about it from the start of care. You're not really looking at it in this portion because until they're your patient, CMS wants us to do QAPI. So what is QAPI? Quality Assessment Performance Improvement. And they want us to focus on like things that affect patient safety, care quality, things like that. Well, it doesn't count if it's not your patient. So this whole system prior to admission is kind of arbitrary to the clinical culture. You know what I mean? Like they're not looking at that. And I think, of course, like CMS is correct in wanting to place this emphasis on safety, on all this stuff. I'm not saying anything, but because of all of this QAPI stuff that we have to do and constantly performance improve, any kind of performance improvement is always focused in that category. They're not really looking at other sections because healthcare companies are clinician first. You are essentially treating patients. That's the primary focus, as it should be, like we said. So we're not really like looking at the other business processes in this way that you would if this was not a healthcare first company and was just like a business, right? Like in a business, you're constantly looking at these kinds of indicators. You're looking at the marketing. You're looking at all of this. This is as important as everything else. But in healthcare, of course, number one priority is healthcare. Like this is where it starts. So I think it's really cool that you identified that, like even just found it.
Yeah. Well, and I think you really hit on it. The whole industry is essentially based around what CMS wants.